Hey guys, how are you all? Welcome back to MedSteps YouTube channel. Today we are in episode 9, that is hand deformities and nerve lesions in first aid series musculoskeleton. So this is very high yield topic and we can see some nerve lesions and their clinical signs. We are going to explore the little anatomy and functions of hand muscles and the nerves controlling them, and the characteristic signs like ulnar claw, median claw, and Pope's blessings, and ape hand, and everything we are going to discuss in this video. So why we are waiting? Let's get started. So if you are seeing this image, you can see here this is the muscles of hand. We have some like we can I'm going to divide like 3 main regions of the muscles. So based on that we are going to discuss. First one, so first group will be thinner muscles group. Okay, this thinner muscles group is innervated by median nerve. Okay, so this thinner muscles in this group we can see 3 types of muscles. First one, opponens pollicis and abductor pollicis brevis and flexor pollicis brevis. Okay, so this flexor pollicis brevis, here we can see this muscle superficial head, the superficial head by median. Okay, and it will be like deep head by ulnar. Okay, so this muscles, if you are seeing this muscle, this is the opponens pollicis and this one abductor pollicis brevis, and here this is final muscle, this is flexor pollicis brevis. Okay, so in functions, what function this muscles will do means, it will, this muscles allow thumb opposition, this muscles will allow thumb opposition and abduction and flexion. Okay, how you can remember this like functions means, we have one mnemonic, that mnemonic will be O A F. O means opposition, A means abduction, F means flexion. Okay, so these are the things for thinner muscles. Thinner muscles we can see in hand, and mostly it's innervated by median nerve. In thinner muscles we can see total 3 muscles like opponens pollicis and abductor pollicis brevis and flexor pollicis brevis. So what's the main function of this muscles means, it will help to allow thumb opposition and abduction and flexion. Okay, next we are going to see the hypothenar muscles. Next one, hypothenar muscles group. So this hypothenar muscles innervated by ulnar nerve. Okay, so this hypothenar muscles innervated by ulnar nerve, and here we can see 3 types of muscles. If you are seeing this here, you can see this is opponens digiti minimi, and we can see abductor digiti minimi and flexor digiti minimi brevis. So what's the main function for this muscles means, here function will be like same function as the thinner muscles, but for mostly for the 5th digit, that means little finger. You can see a function we can see in the little finger. Okay, so then after we can see some intrinsic muscles. Here if you are seeing this image, you can see here intrinsic muscle, that is 3rd group, other intrinsic muscles. In this intrinsic muscles, here you can see first of all lumbricals muscles. That lumbricals muscles will be these muscles. I am highlighting with highlighter this muscle and this one, this one, this one. Okay, so you can see these muscles in between. We call that is lumbricals. This lumbricals is main function is this lumbricals main function is mostly first and second muscles in digits muscles innervated by median nerve, third and fourth innervated by ulnar nerve. Okay, what's the main function of this muscles means? First, it will help for flexion of metacarpal phalanges, okay, joints. So it will help for flexion of metacarpal phalanges joints, and it will help for extend of proximal interphalanges and distal interphalanges joints. This is the main function of this lumbricals. Okay, so in other intrinsic muscles, this is the third group of muscles of hand. Here we can see some lumbricals muscles. In this lumbricals muscles, main function is it will flex metacarpal phalanges joint and it will extend proximal interphalanges and distal interphalanges joints. Okay, so when it's coming to, we have two types of important muscles, that is dorsal interosseous muscle. This dorsal interosseous muscle innervated by ulnar nerve, and we can see this is innervated by ulnar nerve, and we can tell dab, that means dorsally it will abduction. So this is the mnemonic, the dorsal interosseous muscle innervated by ulnar nerve, and it will help for dorsal abduction. Okay, next one, palmar interosseous muscle. This palmar interosseous muscle also innervated by ulnar nerve, and we can see we have one mnemonic, that is PAD, that means it will help to do palmar's abduction. Okay, so these are the muscles group. So we discussed everything about anatomy. So this is the main things for your first aid, you have to know these things. Okay, so now balance of hand muscles at rest. At rest, there is a balance between extrinsic flexors and extrinsic extensors and intrinsic muscles, especially lumbricals. I already mentioned about lumbricals. In this lumbricals, it will help for flex MCP and extend PIP and DIP. In extrinsic flexors, that flexion of it will help for flexion of flexion fingers, for flexion for finger flexion, and extrinsic extensors will be like it will help for extend the fingers. When nerves are damaged, this balance is lost. So it's leading to characteristics of postures or deformity of hand. If you are seeing image, I already mentioned this, I already covered these things about hand muscles. So now we are going to see the hand deformities. These are the hand deformities. If you are seeing this image, you can see here, first of all we are seeing ulnar claw. This ulnar claw will be like clawing at rest. Okay, why I am mentioning this hand deformities, mean this is the we have 4 famous deformities, that is ulnar claw hand and Pop's blessing and median claw and OK gesture and ape hand also. Okay, so first one we are discussing about ulnar claw. Ulnar claw means it's clawing at rest. If you seeing this image, you can see these fingers like this. In ulnar claw happens with distal ulnar nerve injury. If any person have a ulnar nerve injury, then we can see ulnar claw. Okay, this commonly at the wrist. What will happen here? The patient will loss of medial 2 lumbricals. That means that patient can't flex MCP and can't extend PIP and DIP, and fourth and fifth fingers. So these fingers are hyper extended at MCP and flexed at PIP and DIP, like claw appearance. You can see this image. But when the patient extends fingers, that time it's very easily appreciable, and clawing is obvious. So what are the causes can cause ulnar claw? Means hook of hamate fracture and compression at Guyon's canal, like cyclist palsy. So this Guyon's canal syndrome we are going to discuss in our next episode 10. Okay, so that means next episode. So what we can do management of this ulnar claw hand means we can do splinting to prevent contractures, and we can repair the nerve or decompression surgery if needed. Okay, so next one, median claw. In median claw we can see that patient will get like distal median nerve lesion, like median claw occurs in a distal median nerve injury at like carpal tunnel syndrome and or near wrist. Okay, so here what will happen, that patient will loss of lateral two lumbricals, and the patient can't flex that metacarpal phalanges and can't extend proximal interphalanges and the distal interphalanges of second and third fingers, and clawing of index and middle fingers at rest. We can see when fingers are extended. Okay, so what are the causes can do median claw? Means like carpal tunnel syndrome in if patient like chronic severe conditions, that time we can easily appreciate this sign, and lacerations at the wrist. So what management we can do? We can apply splinting in wrist in slight flexion and nerve decompression surgery in carpal tunnel syndrome. Okay, next one, Pope's blessing. In Pope's blessing we can see proximal median nerve lesion. Okay, so Pope's blessing is seen in proximal median nerve injury at or above the elbow. When the patient tries to make a fist, they can't flex second and third fingers. You can see this image, it resulting in extended index and middle fingers, while fourth and fifth fingers flex normally and looks like blessing sign. Okay, so how that Popes will bless, same to same it will look like that sign. Why this thing happened? Because of loss of flexor digitorum superficialis or loss of lateral half of flexor digitorum profundus. So what are the causing this Popes blessings means supracondylar humerus fracture can cause this thing, and pronator teres syndrome also can cause. So what we can do in management, we can apply some splint, elbow splint to reduce nerve stretch and surgical nerve repair if lacerations. Okay, so fourth one we have, that is OK gesture deficit, or you can call proximal ulnar nerve lesion. In proximal ulnar nerve lesion you can see this type of sign, like an ulnar nerve injury at the elbow causes OK gesture deficit. When asked to make an OK sign to patient, the patient can't flex distal interphalanges of fourth and fifth fingers. Instead of circle, they form a flattened pinch. Okay, so what can cause? Medial epicondyle fracture of humerus can cause this OK gesture deficit, because in medial epicondyle that ulnar nerve can pass, so that ulnar nerve will get like stretch or tear. So because of that thing, because of that injury, the patient can't do the patient can't do OK gesture. Okay, in management we can do elbow protection and nerve transposition surgery if needed. Okay, next one, ape hand. I don't have ape hand image. Okay, ape hand, mostly like ape hand. Why this ape hand will happen? Because of median nerve lesion. Ape hand refers to thinner atrophy and loss of thumb opposition, and thumb stays in same plane as fingers. It caused by median nerve lesion at wrist or proximal forearm, and we have to always look for atrophy of thinner eminence in ape hand plus unopposable thumb. So what we can do management means we can opponent splint we can apply, and we can do nerve decompression. Okay, So in summary, I am going to give some brief, like in distal ulnar nerve injury means lesion means that patient, in that patient we can see ulnar claw, okay, and loss of main problem is loss of medial lumbricals, and we can see in rest, or we can see in action. No, we can see in only rest, sorry, not in action. Next one, distal median nerve lesion means we can see median claw hand. In like main problem will be loss of lateral lumbricals. We can see this sign in mostly in resting position. Next one, proximal median lesion, median nerve lesion. In deformity we can see Pope's blessing, and main problem will be the patient can't flex lateral fingers, and we can see this sign in making a fist. Next one, proximal ulnar nerve lesion. In deformity we can see okay gesture deficit, and main problem will be that patient can't flex medial distal interphalanges, and we can see that patient in rest like making a fist. Okay, so I covered everything about this hand muscles, anatomy of hand muscles, and some deformities, and some nerve related lesions and everything. I hope this video clears up the complex but interesting topics of hand deformities and nerve injuries. If you enjoyed this video, don't forget to like, share and subscribe. Comment below which topic you would like me to cover next. Okay, so in next episode 10, we are going to cover we are going to discuss about carpal tunnel syndrome and Guyon's canal syndrome. Okay, take care, bye bye.